This is Dr. Howard Strassler with a Hints from Howard on decision making, and today we'll be talking about evidence-based dentistry, what it means to the way you practice dentistry. Is there any one treatment decision? Well, absolutely not. But there is one constant during the decision process, and that's an accurate diagnosis. It would be nice, though, to have some well-founded guidelines to help guide you in the treatment process, in the treatment decisions. This is where evidence-based dentistry is helpful. So this is what evidence-based dentistry means. Uh, it's a change in the way we make decisions from clinical experiences, sort of trial and error only, to using test characteristics of sensitivity and specificity when evaluating studies on diagnosis and treatment. It actually is very simply weighing the benefits and the harms. How do we make that decision? And decision making is shaped. It's shaped by systematic reviews, where we take all the relevant and acceptable randomized controlled trials of healthcare, and we make a decision. We can use a consensus, which is basically a representative group of experts, and they review the pertinent studies, and through agreement summarize these results to give us a consensus what are some of the best decisions that can be made. And then there are the guidelines that help guide us, established by consensus. And in all cases, we're looking at experts gathering data, using that data to help us make decisions. And when we look at evidence-based dentistry, we're looking at evidence-based dentistry. We can go to the ADA website, ebd.ada.org, where it provides us an idea about how to find systematic reviews, how to find these guidelines. We're actually looking at the ADA Center for Evidence-Based Dentistry. So let's tour what that website has to offer. Well, for one thing, it offers us the evidence itself through guidelines, through critical summaries, and for us and for our patients, a plain language summary of why we're making that decision, or decisions. It may not be just one decision, but a range of decisions. It gives us a link to systematic reviews, and it allows us to really browse the evidence database. Let's look at all the articles that were reviewed to come up with some guidelines, some evidence, some recommendations to us how we proceed. So currently, as of September 13th, 2018, the clinical practice guidelines offered on the American Dental Association Evidence-Based Dentistry website were for oral cancer, for topical fluoride, prosthetic joint guidelines, sealants, fluoride toothpaste for young children, non-surgical treatment of chronic periodontitis, non-fluoride caries preventive agents, and infective endocarditis guidelines. Now, these are not all the evidence that they present. As I said, you can go through the article, it has guidelines, it has consensus, but these are the guidelines that are currently available. And that when we look at these guidelines, and here we're looking at the ADA website as it relates to professionally applied and prescription strength home use topical fluoride agents for caries prevention and clinical practice guideline, notice that it even tells you the year that these things were decided, and that was 2013. And in fact, if you look at the bottom of the guideline, it speaks to there'll be an update in 2019. So this isn't an end-all be-all, but constantly in revision. You can click and look at the clinical resources, and you can even look at patient resources. So there are a number of things that we can look at and information that we can have. There's also the management of patients with prosthetic joints undergoing dental procedures, the clinical practice guidelines from 2014. And once again, on the bottom of this web page, it speaks about an update in 2019. There's evidence base for the use of Pitt and Fisher sealants that was described in 2019 and printed. And in fact, this will be updated in 2019. Once again, this is a dynamic process for making the decisions. So if you wanted to get more information, what are you actually going to see? Well, on the left-hand side, you can get a printable version of these evidence-based practice guidelines for the use of Pitt and Fisher sealants, where it describes the grade of quality of evidence, which is very high. You'll also look at the interpretation for patients, strong recommendations for clinicians, and for policymaking. So these recommendations are very strong. And they'll give you that, is it a high, moderate, low, or very low? And the strength of the recommendation for these sealant guidelines for the use in permanent molars with both sound occlusal and non-cavitated surfaces, that the quality of evidence is moderate, but the strength of the recommendation is strong. And in fact, it gives you information that there's a 76% reduction in caries if children receive sealants. And this is speaking about children, not adults. And in fact, you have a link to the article in the ADA Journal about this evidence-based clinical practice guideline for the use of sealants. And you can see that the report is not only just from the ADA, but also the American Academy of Pediatric Dentistry. There are also guidelines for non-fluoride caries preventive agents, where we can look at recommendations. And once again, it gives you recommendations that are very specific. And in fact, it speaks to using adjunctive therapies for caries management, what are important considerations, how does prevention, patient assessment, and periodic clinical exam fit into caries risk. And so it's not one thing that you're going to get a recommendation that this is all, but really for what specific patient, what specific condition, what specific diagnosis are you going to make these recommendations. And typically among the evidence, they'll have other information for the evidence. They'll have a topic index, and this topic index can be anything from anesthesia, cariology and caries management, community oral health and health policy, dental materials and biomaterials, endodontics, aesthetic dentistry, and the list goes on. And they give you the articles you can link to, the number of articles. And in fact, for endodontics, we can look at 160 unique references to link to those articles. In aesthetic dentistry, 47 articles. In geriatric dentistry, 25 articles. And so it's not just that the guidelines, but also other information that we can browse through in this evidence-based dentist database. And just as important as the guidelines are the listing of information changes that occur, those guidelines that are now outdated. And in fact, in this archive of ADA clinical practice guidelines, they'll tell you that these are now outdated. And the recommendations in 2010 for looking at oral squamous or cancer cell diagnoses, the recommendation for prescription of dietary fluoride. Obsolescence of these guidelines has occurred because the guidelines recommendations are no longer based upon the best available evidence, and the guideline has been replaced by an updated guideline. And so these are really critical that we not just go on what we know. And in fact, the information we've learned in dental school, in continuing education courses, and what we read needs to be current. Looking at what we learned in dental school 10, 15 years ago may in fact be very different today. An area where that might be true is how we look at bioactive materials. how we look at treatment recommendations for implants, that a lot of things have changed as we have more information. And so what I'm hoping you got out of this hints from Howard on decision making is that uh, it isn't just word of mouth as to why we do it, that there needs to be evidence, uh, guidelines, consensus to help us make that decision. Uh, where we are doing things that we've always done, there may be things that we can do better. And there may not be just one answer, and that answer may be more complex based upon the patient's financial concerns, the patient's what they want from treatment, as well as what the urgency of treatment might be.